Good evening. My name is Erica. Thank you for joining our live interactive telephone town hall. We are hosting tonight's event to give Congresswoman Spanberger the chance to speak directly with you, wherever you are, reach as many of you, and answer as many questions about the impacts of COVID-19 on Central Virginia's small businesses, healthcare system, and workforce. As I mentioned, this event is an interactive forum, and we would love to hear your questions from you about this developing situation and how it's impacting you and your family. We'll be taking as many questions from Virginians as we possibly can live on this event. If you have a question, you can press *3 on your phone keypad at any time. You'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from, and the next time you hear your name, you'll be live on the call and you'll be able to ask your question directly. If you're streaming the event on our website, you can simply type your name and question below the streaming player. Additionally, if you'd like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. We could receive a lot of questions during this event, so if we're not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad, or you can type them below the streaming player. If you'd like to receive updates from us via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. All right, now let's introduce Congresswoman Abigail Spanberger. Congresswoman?
Thank you so much, Erica. Good evening, everyone, and thank you so much for joining tonight's telephone town hall focused on COVID-19's impact on Central Virginia's families, businesses, and workforce. I am pleased that you all are able to join us, though unfortunately it is not in person. This is the fourth telephone town hall that we've done in this series since the beginning of the COVID-19 crisis and its impact on Virginia. We hope that tonight will be informative, and I know that reliable information is extremely important as we work to keep our families safe, protect our frontline workers, and plan ahead for the future, including as we plan for how our businesses and our schools will ultimately reopen. Tonight, I'm joined by state officials and business leaders who will be able to join me in providing responses and updated information, and I hope that we will have the opportunity to answer many questions from across Virginia's 7th District. On tonight's call, I am joined by Steve Yeakel, who's the President and CEO of the Virginia Association of Community Banks, Max Moorhead, who's the Executive Vice President and Director of the Commercial Banking Group at Village Bank, Dan Roehl, who's the Vice President of Government Relations for the National Restaurant Association, Dr. Megan Healy, the Chief Workforce Development Advisor for the Governor's Office, and Gena Berger, the Deputy Secretary of Health and Human Resources for the Office of the Governor. As we're talking about the different issues related to individual experiences and PPP and related challenges, I think it's going to be very helpful to have these individuals on the call. I'm grateful for them taking the time. Certainly, Mr. Roehl and Mr. Yeakel and Mr. Moorhead have seen some of the challenges our small businesses have faced here in Central Virginia, so I'm pleased that they'll be able to bring their perspective. Dr. Healy is a great resource as we talk about unemployment and some of the challenges that Virginia's been through as we've been working very quickly here in the Commonwealth to ensure that the federal funding towards unemployment benefits has been able to be applied, particularly for those in gig workers. And then as we talk about some of the challenges related to opening, testing, and where we are, I look forward to having a discussion with Ms. Berger about where Virginia is and what we anticipate into the future. So between all of us, we should be able to answer your COVID-19 related questions and ensure that you have all the resources that you need. I know that many of you are closely following the next steps at the federal level, so I do want to let everyone know that I am continuing to advocate for urgent assistance to our small businesses and our individuals and workers and families across Virginia, and particularly as negotiations continue for the next major COVID-19 response package, I am advocating for increased financial assistance to Virginia's counties and localities. The challenges that we are facing here in Central Virginia across the 10 counties I represent are significant, and we need to make sure that our counties and our localities can keep the lights on, keep the water running, and maintain our essential services, police, fire, EMS, and our school systems across our communities. Thank you again for joining us this evening, and I'd like to invite each of our guests to share a few opening comments and to update us on the current situation from their point of view. Our first speaker this evening will be Mr. Steve Yeakel, the President and CEO of Virginia Community Banks.
Thank you, Representative Spanberger. We very much appreciate the chance to participate in the call and appreciate your invitation. It's my privilege to be here on behalf of 20-plus member banks at almost 100 locations across the 7th District. And as you likely know, we have been very busy. We've been working with small businesses and families and individuals to assist them in every possible way to survive this extremely challenging period. Primarily focused on the Paycheck Protection Program, or PPP. And as most of you all would know, the intent of the program is to help small businesses cover payroll costs for an 8-week period. The program has been successful across the nation. Here in Virginia, adding together the progress made through the 1st of May, there are 86,379 loans at work for $12.6 billion in the Commonwealth of Virginia. But as many of you've read, it's been anything but a smooth process. We received the program rules approximately 13 hours before the program opened. And then when the second round was ready, the second round of funding on April 27th, the SBA system was up for 4 whole minutes and then crashed and provided very limited access for the remainder of the day. But many of our banks planned shift work overnight and got almost all the applications entered by the next morning. So we're hard at work. We're actually pleased that those challenges drew focus from media and caught the attention of policymakers in Washington. And we're grateful that Representative Spanberger was the first signature on a letter from several members of Congress to the agencies urging assistance for community-based institutions. So we still don't have the form that's required by the SBA to let them know when a bank has dispersed funds. We still don't have guidance regarding the loan forgiveness process, but we're still anxious for folks to come and see us, for businesses to come and apply. There's still a significant amount of loan funding available, so we encourage folks to work with their local community bank, or if they don't work with a community bank now, to visit a community bank near them, and we'll be as helpful as we possibly can.
Thank you, Mr. Yeakel. I'm going to go to Gena Berger, who's the Deputy Secretary of Health and Human Resources with the Office of Virginia Governor Ralph Northam.
Good evening, everyone, and thanks to Congresswoman Spanberger for the opportunity to provide an update tonight. So I wanted to go over what's going on in 3 kind of key areas. One is testing, the second is contact tracing, and then the third will be how these 2 things and our collective efforts are really working towards lifting some of the restrictions and on businesses, and also that we've had like a stay-at-home order and other types of restrictions. So first, in the area of testing, some really major developments that have come about over the last month. We, in the beginning, when we got our first coronavirus case, we were really focused on testing people with symptoms. So this was due to limited testing capacity. And several weeks ago, we announced some expanded testing options for long-term care facilities and other congregate settings. So what the governor announced was that we would open up an option for what's called point prevalence survey testing, and that's testing everyone in a facility on the same day to determine prevalence at that point in time. And when we first rolled that out a couple of weeks ago, it was upon request from a facility. They contacted their local health department, and we started the process to provide support for that testing. Now we are moving into a phase since we've really been building much more substantial capacity for testing. We're now moving to more proactive testing. We've stood up a team at our central office in the health department who's going to be reaching out regionally to our long-term care facilities, to correctional facilities, and other congregate settings like homeless shelters, where we know the populations are at a very high risk. In addition to substantially scaling testing for these high-risk populations, we are also undertaking an effort to expand testing in the community. So we're working with primary care providers and their offices to get them the PPE and the testing supplies and to make sure that they have access to that. Also, our federally qualified health centers, free clinics, for instance, as well. Our goal is really to get to a point where we are testing about 10,000 people a day. Over this past weekend, we have seen a pretty substantial uptick in our testing capacity. So over this past weekend, we tested over 6,000 people a day. And so we hope to continue to see that grow. The second thing I wanted to talk about was our efforts in contact tracing. So our local health departments actually have a very good foundation of this. We are one of the states that has really invested in these efforts traditionally. So we have had a strong foundation, but we are really beginning efforts to greatly increase our contact tracing workforce. And the governor announced earlier today that we are planning to hire about 1,000 new contact tracers and a couple of hundred case investigators to help us with these efforts. Obviously, testing and contact tracing are essential in order to have a phased reopening. So the governor did announce today sort of the plan for that business reopening and economy reopening and some lifting of some restrictions, and also talked a little bit about the data that we are looking at to guide those decisions. So there's a couple of data points that we continue to look at. One is the percentage of positive cases. So we're really looking at, is that percentage of testing, if the tests that we get every day, is that going up or is it starting to trend down? We're also looking at the deaths that are reported by day and where the trends are there. Hospitalizations, we're looking at our hospital bed capacity as well as our personal protective equipment supply chain and whether hospitals, local healthcare providers, our long-term care facilities, and others who require PPE have an adequate supply. So those are some of the criteria that we're looking at to inform the reopening. The governor did announce last week that he was lifting the restrictions on non-urgent, non-essential procedures and surgeries. So we did have for about a month, the governor had issued an executive order placing a limitation on non-essential procedures and surgeries, and that was really because we were seeing a shortage of personal protective equipment, and we needed to preserve that equipment. And so many of the hospitals and healthcare systems did this voluntarily in the beginning as well, and they were definitely our partners in that. But as we've received more shipments of PPE. We've found different avenues to get personal protective equipment on our own and distributing that in our communities. The governor did on Friday lift that restriction, and non-urgent, non-essential procedures can continue now. So the next phase that we're looking at is lifting restrictions on what the executive order calls retail and non-essential retail businesses. And so the governor did announce today that he is extending that order on business closures for certain businesses to May 14th. So that is next Thursday. So he extended it for an additional week. And as long as the data that we're using continue to go in the right direction, we do believe we will be able to begin a phased reopening for businesses. There will still, I want to be clear about this, there will still be a number of restrictions in place, and businesses will have to adhere to certain safety guidelines for that reopening. And it will be a phased reopening, but you will still see and experience restrictions like social distancing, the number of people that can be in a space. Businesses will need to do a lot more in the area of cleaning and disinfecting more frequently. So, but we are using all of these tools, so testing, contact tracing, to really start to inform this process of reopening the economy again. Thank you.
Thank you so much, Deputy Secretary Berger. Now we're going to hear from Dr. Megan Healy, who's the Chief Workforce Development Advisor for the Office of Virginia Governor Ralph Northam.
Good evening, everyone, and thank you, Congresswoman Spanberger, for having this town hall. It's fantastic, and I want to thank you for everything you do for the families of the Commonwealth and specifically the workers. As a Chief Workforce Development Advisor, I do all things workers, and that's making sure that Virginians have the right skills to get their dream job. And then when they get that job, I want to make sure that the workers are safe, and specifically in this COVID-19 world, that they feel comfortable going to work. I also work on discrimination, wage theft, misclassification, cases of workers. And then lastly, during this COVID-19 is about unemployment. So when that worker leaves their job temporarily, we want to make sure that they can provide food to their families and pay their rent. And so that's when we have the additional unemployment benefits. And so really with unemployment is that we've expanded the definition of unemployment. One is that the number of weeks, it was 26 weeks, and now it's 39 weeks, thanks to Congress, as well as Congress also through the CARES Act increased the payments additional $600, so a Virginian can get up to $978 per week until June 25th. And then also expanded the eligibility to gig workers, independent contractors, sole proprietors, that they can now go through a pandemic unemployment assistance program. We launched that portal, that Gov2Go portal, on April 19th. Last week, after we've had over 560,000 people apply for unemployment. Around 75,000 of those qualify or have applied for the pandemic unemployment assistance. That's those gig workers and independent contractors. And last week they went into their account to certify, and so tomorrow is the first day that we'll be getting benefits out to that special population that's beyond the current the eligibility that we had for the unemployment benefits.
All right. Thank you, Dr. Healy. And then we're going to hear from Dan Roehl, Vice President of Government Relations for the National Restaurant Association.
Thanks, Congresswoman. I really appreciate you having me on this evening. For those of you on the call who haven't heard of the National Restaurant Association before, just kind of a quick synopsis of who we represent. Obviously, it's the restaurant industry. We represent some of the bigger chains you've heard of, but by and large, we're an association and still an industry that's dominated by small businesses. As I think everyone can imagine, we're in a pretty unprecedented situation for the impact COVID-19 is having on the restaurant industry. And to give you a sense of that scale and scope, in the state of Virginia, there are about 15,507 restaurant locations employing 378,600 individuals. About a week and a half or so ago, we came out of the field trying to get a sense of what our industry looked like today. And, I'm sorry to have to report that we roughly think there's about 237,000 of those jobs that have currently been furloughed in our industry. And obviously, it's probably not surprising when you look at the steps that have had to be taken to protect and support public health. From an industry standpoint, we estimate that the COVID experiences you carried out throughout the rest of the year could impact the industry by a total of $240 billion. So obviously in our industry, there's a lot of times when, our members don't necessarily come looking to the federal government for assistance. But in such an unprecedented situation, we're very pleased and want to thank you, Congresswoman, for your support for helping get the PPP program up and set up. I should probably also thank Stephen in the banking industry, who have really done a great job under a very trying situation to help our members get access to these loans as much as possible. But I also want to thank you, Congresswoman, for your support for trying to make the PPP program be as flexible for our industry as possible. Obviously, with a lot of our businesses closed to protect public health, it's just made the dynamics of that program more challenging to address with just having lower payroll. So we appreciate your continued efforts to make that program as kind of flexible as it can be. Lastly, let me talk a little bit about kind of what we're looking at going forward. We appreciate everything that the governor's done as well to put the infrastructure in place to, hopefully if we can make it through the next week or so here, start the process of reopening at the association as well. And if anybody wants to go to restaurant.org, we've got a lot of this information on there. We've worked together collaboratively with federal health officials, with academia and industry experts to really put together a best practices guideline for what reopening of our industry can look like and what type of steps can help protect our employees, protect our customers, and really build confidence and hopefully revitalize the industry as we move forward in this process. So happy to answer questions and move forward, but really appreciate you having us be on the call tonight.
Thank you so much, Dan. And so as you've heard, we've got a number of great experts in their fields who have joined us. I hope that it adds to the conversation. And with that, I will kick it back over to Erica, our moderator, to begin taking your questions.
Wonderful. Thank you, Congresswoman. And again, I just want to remind everyone this is an interactive COVID-19 focused forum, so we would love to hear your questions. If you have a question, press *3 on your telephone keypad at any time to get into the queue to ask your question. A member of Representative Spanberger's staff will collect your questions and will answer as many as we can during this live event. Again, that's *3 on your keypad to get into the queue. If you're participating online, you can submit your question below the streaming player. Just a reminder, if you'd like to get in the queue to ask a question, again, *3. If you're streaming online, you can submit your question below the streaming player. If you'd like to receive updates from us via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. All right, let's go ahead and go to our live questions. The first one we have is from Blanche. Blanche, you are live with the Congresswoman. You can go ahead and ask your question.
Hello, Representative Spanberger. Thank you for your call, and I enjoyed meeting you last year, I believe. My question has to do with the testing and the tracers. 4 parts to my first question. Where are the tests coming from? How reliable are they? Why in the world is it taking so long to get enough? And what is the cost of the test?
All right. I tried to jot those down for you quickly, Blanche. So I'm going to start and speak at a federal level in terms of what the challenges are that we're facing with testing. And then I'll see if Gena Berger from the state wanted to add anything. So first and foremost, testing, at this point, we haven't had a national testing strategy, and so the provision of testing has really been on each individual state to pursue the purchase of tests, the purchase of components for tests, and to deploy those tests. And that has been a challenge across the board for states. There are states competing with states for those purchases. There's states competing with their own health systems. And then in some really challenging circumstances, there have been cases where the federal government has actually taken states' purchases from them. So it continues to be a challenge. Among the challenges facing our testing process is the lack of personal protective equipment. With such an infectious disease, it is vitally important that those administering the test have the ability to protect themselves, both for their own health, but also for the health of those coming through the testing line, or those they might test subsequently. Personal protective equipment continues to be a challenge. I've seen some numbers here in Virginia that we have stabilized our need for PPE, or at least the emergent nature of our lack of PPE is on the decline, which is a positive trajectory, but we still don't have enough. As it relates to tests, in addition to the PPE that one needs to wear in order to give the test, there's also the need for nasopharyngeal swabs. Typically, these tests are use a particular type of swab, and there's been shortages of those. There's been shortages as well for reagents, so the chemicals necessary to develop these tests. This has created significant challenges. In the last bill that I just voted on, the Paycheck Protection Program and Healthcare Enhancement Act, we provided billions of dollars in funding to assist the states in their ability to purchase tests and test components. That assistance is vital, but it doesn't remove the fact that there continues to be a challenge getting those components. Among the things that I have from a federal level worked on to assist states and our localities in getting testing is I'm an original co-sponsor of the Testing Procurement Act, and this bill instructs the President to use what's called the Defense Production Act to ramp up the procurement of testing supplies, and it also would require that the President issue purchase orders for the program of national urgency and ensure that under the DPA we are purchasing all of the components necessary to conduct testing nationwide. There's also I've also co-sponsored a number of other bills focused on PPE, focused on supply chain challenges, and I am an original co-sponsor of a bill called the Medical Supply Chain Emergency Act, and provisions of that were included in the CARES 2 bill. So from a federal level, the overall answer is, federally speaking, Congress is appropriating dollars to demonstrate how vitally important testing is to our ability to reopen and to protect lives. We have allocated billions of dollars for use under the Defense Production Act, be it for PPE or be it for testing. The President has just last week utilized the Defense Production Act for nasopharyngeal swabs. Thus far has been unwilling to use it for reagents, so that continues to create challenges. At the federal level, I will continue to support funding. I will continue to advocate for a national strategy that will allow states of any size, of any scope, to be able to administer the tests that they need in order for us to keep our country safe. And specific to what's been happening here in Virginia, I'll ask if Gena would like to provide any additional information. I know in her intro she gave some updates on where we are with testing, but maybe if she could speak to some of the challenges we've seen over the past couple of months and what we're seeing now that might add to the answer to Blanche's question. Gena?
Yes, thank you, Congresswoman. I think you did a great job of outlining the challenges that we have faced and are really starting to overcome at this point. But one of Blanche's questions was, where is the testing? So in the beginning, if you remember, our state lab, the Division of Consolidated Laboratory Services, our state lab was the only one who was approved from CDC to do the testing. So with limited testing supplies and limited testing capacity, the criteria for testing was pretty restrictive in the beginning. And we were able, as commercial labs were allowed to come online, so your LabCorp, your Quest, other labs were able to come online and got permission from the CDC to also begin testing. That's when we were really able to expand. In addition, some of our university medical centers have begun to assist the state with large testing efforts. So UVA, VCU, and our understanding is that Virginia Tech will soon also be coming online to help support with testing. And hospitals and healthcare systems are now testing as well. And so I think one of the other questions that you ask, and it's very important for me to address this, is it reliable? So all labs that want to do COVID-19 testing have to go through a validation process. And our lab, the director of our state lab, often gets asked this question about reliability at a lot of the press conferences for the governor. And, she walks through the process of what a lab has to go to get approved to do this. And she would say that she has a tremendous amount of confidence in tests that have been approved to do these, and labs that have been approved to do these tests. In terms of the cost, I think all of our commercial insurers are now covering the costs of for those who are insured, our Medicaid and CMS, so public payers, are also covering the complete cost of tests. And I would also say that for, I mentioned point prevalence surveys, so that's, in a long-term care facility, in a correctional facility or others, that is public health supported testing. So the state is supporting all of these major congregate care setting tests as well.
And this is Abigail Spanberger. I'm going to jump in with two more points to round out Ms. Berger's comments and answer Blanche's question. I did want to add that in the bill that we passed in the House back in middle of March, the Families First and Coronavirus Response Act, we did authorize and appropriate the dollars to pay for COVID-19 tests. And again, that's separate from the challenge of actually getting a test. But at the congressional level, with tremendous bipartisan support, we asserted that it's necessary that price cannot be a challenging factor for anyone to be able to get a test. And then I did want to comment on the discussion of serology tests. So these are the tests that some folks are talking about now, that it's not to test if you have the virus, but it's a test that would test if you have the presence of antibodies indicating that you would have had the virus. And I've worked extensively with Rep. Don Beyer from Northern Virginia to try and urge the FDA to more closely regulate serology testing in an effort to try and get more of those tests out in the public sphere. There have been some challenges, and with the serology tests, so not to determine if you are currently ill with the virus, but if you might have already had it, the accuracy of those tests varies very greatly. And some of the challenges there is we don't want people to have a false sense of security. If they think they've had it, then they think they might be immune. Notably, I would add for anyone listening in that there is still inconclusive data related to if you've had the coronavirus, whether you are immune, and if you are immune, how long that immunity lasts. So there's a lot of good research happening in that space currently, but it is vitally important that if we determine there is immunity bestowed because one has had the coronavirus, it's going to be very important that we have good serology testing. And as of right now, it appears that the FDA is implementing many of the requests that Congressman Beyer and I made of them to ensure that we have greater certainty in the serology tests on the market. And with that, I will give it back to Erica for our next question. Thank you so much, Blanche.
All right, let's go to Regina. Regina's in Reva. Regina, you are live. Go ahead and ask the Congresswoman your question.
Yes, ma'am. Thank you. I just wanted to know and make sure that we could go. I own a small restaurant in Culpeper, Virginia, and I wanted to make sure we could go to restaurant.org. I think I heard them say, one of the young ladies say, for guidelines in regards to May 14th, 15th reopenings.
Yes, ma'am. I will ask if Gena Berger or Dr. Healy, Megan Healy, would like to take that question related to the state guidelines.
This is Gena. I'll take it. Sorry. The guidelines will be posted, so they'll be coming out in the next day or two in terms of what the new guidelines will be for any of the businesses reopening and lifting those restrictions. It will be on the governor's coronavirus website for sure, and also our Virginia Department of Health coronavirus website.
And Regina, did you have a specific question about what those guidelines are for reopening?
Sorry, Congresswoman, Regina is no longer with us. She's still listening, though.
Okay, excellent. Well, and Regina, we will be sure to put those out on our congressional website, our Facebook, on social media as well. And then, Dan, given that Regina's a restaurant owner in Culpeper, did you have any comments in terms of any resources that you might have available for restaurant owners across Virginia's 7th?
Yeah, I appreciate it, Congresswoman, and I think I unfortunately confused her a little bit earlier. We did put together as an association a guidance document, but it was really because a lot of governors' offices were asking for our industry's input in the process. So she should definitely listen to what Gena just laid out as far as the actual guidance coming from the state on how to reopen. But obviously our goal has been to protect our employees and to ensure that patrons coming in have as safe an experience as they can have while coming into the restaurant. So I certainly hope she's hanging in there. Obviously, it's been a difficult time for a lot of the industry, and I'm sure she's looking forward to being able to reopen here soon.
Thank you.
Great, thank you. Let's go to our next question. This is actually online. Wendy wants to know, many students work to pay for college expenses, but because they were claimed by their parents, they're not getting a stimulus check. How can this be fixed?
Wendy, thank you so much for this question. This has to be, and for those on the line, the recovery rebates, which are the direct payments to individuals across the country based on salary thresholds, give up to $1,200 per person and $500 for dependent children. But unfortunately, in this legislation, excluded were adult children who are dependent. So if they are claimed by their parent as a dependent, they themselves are not getting their recovery rebate. And so how this needs to be fixed, this needs to be fixed by legislation. And I am a co-sponsor of a piece of legislation that would change this. A piece of legislation is sponsored by a colleague of mine out of Minnesota, Angie Craig, and it's I believe the full title is the Every Dependent Child Counts Act, and so that would rectify this. Please, you should know, Wendy, any future efforts that we may, from a congressional standpoint, be making to deliver direct aid, that there will be a bipartisan chorus of individuals ensuring that we don't leave out dependent or young adults who are claimed as dependents by their parents.
Great, thank you, Congresswoman. Let's now go to Patricia. Patricia, you are live. Go ahead and ask your question.
First of all, I'd like to thank Congressman Spanberger for all you're doing. I don't know how you get to everything, and your family too. God bless you for all you're doing for everyone. My question is regarding mental health. I am very blessed to understand why the virus is here, and the governor shared some of the good things that are coming out of all this, and I'm on the bandwagon with that. However, I am concerned about the mental health of individuals, of human beings in the entire nation. Everyone, as I said, is very grateful for all that's being done, and we're grateful to the doctors, nurses, and all the people that are helping to heal. But there's two things that need to be done, I feel, in the area of mental health, and that is CBS is the only station that I know is recording discharges from hospitals, and Dr. Oliver said that's difficult information to get. I don't know how CBS is getting it, but it's really very, very important that people know that everyone who gets this virus does not die. We have children that are home from school, and what else do they have to do but the internet and what they see on TV? And it's very important that we strike a balance. The people that are in positions, that we strike a balance to let our children know that they don't all die. And as of yet, I don't know of anyone, any individual or organization that is focusing on the mental health of children, of our mental health population that was challenged before coronavirus even began. And people are doing crazy things. There are even people, I understand, that are afraid to get the testing because they're afraid all the information is going in the system. And there's a lot of things that could be prevented if there were more people involved. Do you know whether the governor has a committee to deal with the mental health of human beings affected by this virus. Thank you.
Thank you so much, Patricia, and thank you for your kind words at the beginning of your question. I'm going to ask Gena Berger from the governor's office in a moment if she'd like to add anything. But first, I wanted to make you aware that within the CARES Act, which is the bill that we passed the very, very end of March, we had $100 million in flexible funding available to address substance use disorders and provide mental health resources to support youth and America's homeless population during this pandemic. That's an incredibly important piece of the CARES Act. We also provided additional $15 million for supplemental grants to aid in telehealth. And for one of the reasons behind that effort to ensure telehealth resources are available is clearly during a time of a pandemic, if someone can get the medical assistance that they need via telehealth consultation, that is ideal. But specifically when it comes to issues of mental health, those are services, depending upon the need of the patient, that can be delivered via telehealth. And so Congress's bipartisan commitment to expanding telehealth opportunities is something that is helpful on the mental health and overall health aspect of things. And then also in terms of what we've done as it relates to funding state and local public health and community health services and locations that overall do provide mental health services within our community, we have made sure that they have additional funding, recognizing that they would be facing additional challenges. I appreciate your comment about the need to talk about the rates that individuals are being released from the hospital and the recovery rates. With 3 children at home and certainly their life upended because of school closures, there is a very clear importance to sharing some good news as it's available. I would also note that one of the things I'm advocating for in our next relief bill, I pushed for it, and we didn't get it in the last negotiations, is support to our local communities and localities. This is vitally important because it's our counties, the 10 counties I represent, they do a great job typically of budgeting and creating the sorts of communities that we all want to live in, but they couldn't have planned for a pandemic that would have cut virtually their entire revenue base, just as our small businesses couldn't have prepared for anything this catastrophic. And so I am supportive of relief funding to our localities, primarily because at a time when we are trying to see ourselves out of this pandemic, it is so important that we not put our localities, our county communities, our town governments in the areas of the 7th where we got towns on a trajectory where they have to start cutting their budgets, because the things that I do not want to put at risk are teachers, first responders who might be dealing with someone with a mental health crisis, teachers, school counselors, and other professionals that are there to help our community across all aspects, but particularly in the mental health space. And so right there, I'll ask Gena Berger from the governor's office if she wants to comment on Patricia's question as it relates to mental health at the state level.
Hi, Patricia. Thank you so much for that question. Our governor established what we call the Children's Cabinet early on in his term, and that is really made up of all our secretariats, our state agencies that have a role in serving children and families across the Commonwealth. And we have really been focused even before the coronavirus outbreak on the resiliency of children and families in the Commonwealth, and focused on childhood trauma and its impact, and just focusing on 2-generation strategies around that. So I absolutely thank you for that. Funny enough, this is what the governor has declared this week, Resilience Week in Virginia, and that's really focused on addressing the trauma that many children and families are facing in this crisis and at other times in life, and how to focus on the factors, resiliency factors that can really interrupt that that trauma and that cycle. We, through the Children's Cabinet, have been working on a number of mental health initiatives, especially for children. We have what's called the Virginia Mental Health Access Project in Virginia, which is helping primary care pediatricians get connected with expertise in mental health for children. So we have a lot of projects that are focused on this, and we do have groups that are focused on this. But what a timely question to ask as part of us really focusing on resilience in this time. And so thank you again for that question.
Great. Let's go to Michael. Michael's in North Chesterfield. Michael, you're live. Go ahead and ask your question.
Yes, Abigail, thank you so much for your support through all this. Your office reached out to me personally, and I really appreciate that. That was very kind. I'm a self-employed individual, and I'm trying, working through the unemployment system, and I just received my notice of how much I'm going to receive, and from the state, it's $158 a week, and of course, the $600 on top of that from the federal government. And my question is, what are they basing that off of? Because they never asked me for any kind of proof of income or 1099s or anything like that. And, that's kind of that's less than half of the maximum that we can receive from the state, the maximum being $378. So I just, was wondering what they're basing that off of.
Michael, I'm going to see if Megan Healy can answer this question for you from the state office.
Thank you.
Thank you, Michael.
Thank you.
Great. Michael, thank you so much for that question. And so there's two types of unemployment. One is the first unemployment that you signed up for, the basic application. And if we found any record in the last year that you were on someone's payroll and they paid payroll tax, then that's how we would do a basic formula. You did mention that, so I'm just saying if you have a part-time job or a little job or some type of you're on someone's payroll, then that calculation was probably based off that. It's usually people that are independent contractors, gig workers, sole proprietors, own their own business. If we can't find that payroll match, then you get kicked to the Pandemic Unemployment Assistance Program, and that's that portal where you go in, and that's where you should have uploaded any of your tax records, previous tax records, or we're also taking profit loss calculations, letters from accountants, 1099s, and that's the documentation that you post about your potential income in the last year, and then the formula is based off of that. So it must have been maybe somewhere in the system, I would say, that you had somebody was paying you some type of payroll. If it's very, very part-time, then they did the formula off that. So I would recommend possibly going into your portal. And there's two portals, so it seems like you probably did not get kicked to the PUA, the Pandemic, the Gov2Go portal, that you can go on to vec.virginia.gov and go in and look at your account and see if you can make adjustment there, or you go into the VEC and then you can chat with somebody, or that you can call the number to ask about how you can possibly get kicked over to the Pandemic Unemployment Assistance Program to show your full income in your current position or situation.
Wonderful. Thank you. Let's go to our next caller. We have Merrill in Richmond. Merrill, you're live. Go ahead and ask your question.
Yes, good evening, Representative Spanberger. Thank you for this chance to talk to you again. My question was, I watched Governor Northam with the different steps as to opening up the economy, and my question was, if we go from like 1 to 2 or 2 to 3, and then the infection rates go up, are we going to go backwards?
I'm going to ask Gena. Thank you, Merrill, for the question. I'm going to ask Gena Berger from the governor's office to answer this question.
Yes. So very important question, Merrill. Thank you. We have a slotted amount of time in between each kind of phase that you were referring to that the governor talked about today, but really on a daily basis, we are watching all of these data points to determine what the impact is of social distancing measures, additional restrictions. So we will be watching those numbers very closely, and we will be acting based on that information. And so what we are doing right now is waiting and watching very closely for a prolonged decrease in the percentage of positive cases. We are seeing our hospitalizations flatten and our deaths decrease, which is very positive. But we are first and foremost focused on safety, and so looking at those numbers will be something we do every day along the way. So we will be watching them closely, and when we have the actual guidance that comes out, you'll also see that there is an extensive period between phases. So once we go to phase 1, there's going to be about 3 to 4 weeks with watching very closely that data to determine whether infections are increasing, whether hospitalizations are increasing, et cetera. So definitely we'll be looking at the data to make all of these decisions.
Wonderful. Next we have Jan. Jan, you are live. Go ahead and ask the Congresswoman your question.
Hi, thank you for taking my question. I'm a nanny and sole income in my family, and I have concerns about the family I'm caring for their children, that they're not necessarily practicing the best social distancing rules, more so in the last week and a half. So I was concerned that if I resigned, I would not be able to qualify for unemployment insurance.
Thank you for your question, Jan, and I'm sorry about your circumstance. I'm going to ask Megan Healy from the Governor's Office, who handles workforce issues, to address this question.
Yes, thank you for the question. So you are right. So if you do resign or quit your job, that you do not qualify for unemployment insurance benefits. We do, after you go through that process, you can still try to apply, go through that process, and then you can say that. And then we have a kind of appeals process, adjudication process, when we ask you additional questions. Was an unsafe work environment, potentially if there's any other health concerns, then that appeal process could actually then get you benefits. But if you check the box that you quit your current job, then you will not get benefits. But we do have the appeal process. So some people have gone through that appeal process because of their health situation or their workplace situation.
And Megan, just an approximate, so Jan knows what that would look like. Is there a typical time frame for what that appeals process length of time is?
Yes, and so it'll take about a week after you apply that you'll know that you've been denied the benefits. And then there's different types you could to call in or through the appeals process. It is because we do have large volumes and we have extra communications and additional questionnaire. It could take up to 2 to 3 weeks. We are hiring 45 new people just to help support this process, this appeals process, because we need it, because we had to kind of ramp up our staff very quickly in a short period of time. So it will take 2 to 3 weeks. But just make sure you have your documentation. If there's anything that you can cite to verify the situation, that would be important.
Great. Let's go ahead and go to our next question. We have Jeanette. Jeanette is from Powhatan. Jeanette, you are live. Go ahead and ask your question.
Yes, I was concerned about the social distancing. I appreciate everything you all are doing, Ms. Spanberger, and I'm rooting for you every day. And about the social distancing at the church, like I said, if they open the church, I think he said maybe at the end of this month. I was wondering, would you have to wear a mask, and how could you social distance at the church?
Gena, thank you so much for your question. I'm ultimately going to ask Gena Berger if she can answer this one from the state level, but I just did want to note I have been in touch with faith leaders across Central Virginia. I know this is a very challenging time for congregations of all faiths as we are kind of abandoning some of the normal events and church services and religious services that are so important to so many. I think I'll just state overall it's important to wear a mask as we continue to try and get the virus under control that protects both the person who's wearing the mask and the community around them. So I think even once we open, for those willing to do it, continuing to wear a mask will be a prudent thing to do. But I'll ask Gena if she wants to comment on some of the state recommendations as it relates to religious communities and religious services.
Yes, Jeanette, thank you so much for your question. We did part of this, the process of putting all this guidance together, both for businesses in general and then also sector specific, was we had a working group that did this, and there was representation from the faith community on that group. We have been getting the feedback from leaders of faith communities across the Commonwealth about, as we put together guidelines, how easy or difficult it would be to meet those guidelines. There will be guidelines in there about social distancing. There will be guidelines about wearing a facial covering. And there will be there are lots of different sections of it that have guidance for specific settings, including faith environments. So that will be addressed, and we have gotten feedback from different members of the faith community with ideas that they have about how it could be accomplished. But as Congresswoman Spanberger said, even the quote-unquote reopening is going to look very different than before we knew about coronavirus. There's still going to be a suggestion to wear face coverings for some sectors of the economy. There will be a requirement that workers wear face coverings, both to protect themselves and to protect consumers, as the Congresswoman said, and there still will remain, social gathering bans and for more than 10 people, at least in phase one, and then also still requirements to and recommendations around physical distancing. So thank you.
All right, next we have an online question. This is from John. He wants to know what is being done to make sure PPP and EIDL are going to small businesses, not just the larger businesses.
So thank you for this question, John. I'll start by saying when we rolled out the CARES Act at the end of March, there were some significant challenges initially. Steve spoke to the fact that there were 13 hours of guidance provided by SBA before lenders were starting to provide, to accept those applications. It's been a bumpy process, but what I've heard across the district from small business owners is despite some of the hardships and the challenges, ultimately it is a very, very important program. One of the things we did in the bill that we passed a week and a half ago to provide additional funding for PPP was to fence off dollars and protect those for the smaller community banks with the direct intent and knowledge that smaller community banks deal directly with much smaller community small businesses. So that was the approach that we took in order to ensure that a large portion of those dollars are delivered to small businesses by smaller banks. But I'll open it up to Steve and Max if they want to if they'd like to provide additional information about what the experience is like from the lender or what a borrower might go through in that process.
Thank you, Congresswoman. I appreciate the answer, the chance to answer the question, John. I'll just say recent media has been a little bit more focused on the loans going to large borrowers, and the data is replete with all sorts of examples of how most of these loans are going to very small businesses. The data I have just from this second round, for instance, says that 1.6 million loans went to were of a size of 50,000 and under, and that was the largest category of approved loans. And the next largest number of loans, 304,000 to businesses between 50 and 100,000, 121,000 loans to the next category, 100,000 to 150,000. So you get my point. The statistics we've seen from our banks indicate that most of our loans are within a range, roughly speaking, of 70,000 to 150,000. Certainly the media, offers you some, some examples of places where the loans have been quite large. But frankly, I have a concern that there are businesses, smaller businesses, who do qualify, that let the perception of heightened scrutiny keep them from applying, and so I do think that every effort is being made reasonably to make sure the loans get to smaller borrowers. I think that Congress originally intended the bill to be available, that the funding would be available quickly, and so they limited some of the really voluminous and thick due diligence that needs to be done, and that was a good intention on their part. But I can assure you that the vast majority of these loans are going to small businesses. Max, I don't know if you want to add anything, but I feel confident about that.
Yeah, just to pile on, Steve, I'll divide PP up into round one into round two. Round two, the average loan size has been significantly smaller, and most of the borrowers have been independent contractors, sole proprietors, that type of business person. So the average size is a lot smaller, and there's still capacity for those individuals and business owners to apply to their bank.
Great, thank you. We have time for one more question this evening, and that's going to be Rick. Rick from Glen Allen, you are live. Go ahead and ask Congresswoman your question.
Yes, ma'am. Good evening. Congresswoman, I just wanted to thank you for having the call and getting some reliable information out. And a little bit of the data that I'm going to use as far as numbers is probably 4 or 5 days old, but it's more for relative terms. So if you could speak to that, I'd appreciate it. It's kind of a two-part question. I was reading, I guess about 4 days ago, that the state of Virginia was 49th in testing, and I wondered if that was true, and if so, why. And secondly, I was watching a piece on the news the other night that said that we'd had like 180,000 tests the week before, and it gone to 200,000 nationally, and that some of the increase in our number of cases were due to increased testing. And I was wondering if you guys could speak as to what our expectation is for tests in the state of Virginia. And I guess they'd have to be consistent week in and week out to figure out how that data works. And I'll be quiet and let you guys answer. Thank you.
Well, thank you so much for the question, Rick. I'll start with the answer, and then I'll see if Gena Berger from the governor's office wants to add anything. The challenge with testing, and the number that you stated last week in terms of where Virginia fell was correct. There were kind of a bunch of states clustered towards the end, and I will note, just as a Virginian, that the numbers are pretty close, though I'll let Gena Berger talk about that a bit more. Some of the challenges we're seeing with testing, it all relates back to availability of personal protective equipment and the availability of testing supplies. And from the federal perspective, what I've done is focused on advocating for a national testing strategy, advocating for, through legislation and through efforts on Capitol Hill, for us to ensure that all of our states have the access to the personal protective equipment necessary to administer the tests, and then the components of the test. We've seen real disparities between which states are getting what in terms of PPE. And we've seen real challenges to states that attempt to purchase it on their own. I mentioned in an earlier question that there have been states that have had the federal government take the purchases that they have made. Just recently, the governor in Maryland essentially orchestrated almost a covert operation to ensure the delivery of PPE from South Korea and then transported it in kind of secrecy so that it couldn't be taken. That is a real challenge, and that for me is indication of a continued problem. Our states are working to adapt, and I am appreciative of Gena and the rest of the folks at the state level who are working to adapt, but it does come down to a major resource issue. As I understand it, our goal here in Virginia is to get to 10,000 tests per day. There's been significant increases recently, and so we're up to about 6,000 a day over the weekend with the average, and it is going to be vitally important that we have the ability to test and then contact trace folks across Virginia if we are going to have openings and then sustain those openings in a way that is both helpful to the economy and also helpful to our public health priorities. So from a federal perspective, I'm going to continue to advocate for the use of the Defense Production Act. I mentioned to an earlier question that I'm an original co-sponsor of a variety of pieces of legislation. I am very pleased that last week the President announced he will finally use the Defense Production Act for the production of nasal pharyngeal swabs. That should help the supply chain challenges here in the United States and certainly the ones that we're seeing in Virginia. We still have challenges as it relates to reagents. So sometimes when we hear talk of tests and the availability of tests, you cannot administer a test if you don't have the swab to administer it. You can't administer a test if you don't have the PPE to wear while administering it. You can't administer a test if you don't have the reagents to actually develop it. So there has been a disconnect from what we're hearing from the administration in the White House and what's actually happening on the ground. We're working hard. Everybody's working hard. There's a coordinated effort, a bipartisan priority on Capitol Hill, and as we continue to work on that, and then within the Commonwealth, Virginia is headed in the right direction. I mentioned that 10,000 tests per day goal, and I will ask Gena Berger if she'd like to add anything additional to the comments related to the work that's been happening at the state level.
No, I think that was a great, right on the explanation that I would have given too. It's just there were numerous challenges in the beginning in terms of the supplies, and PPE, had been one of the major challenges. If you talk to, as we try to start scaling up and we started surveying different physicians and different providers, types of providers, about what it would take for them to start doing more tests in their office. That's what we learned, is that they didn't have the proper PPE to do it. They didn't have the swabs. They didn't, have their lab didn't have the supplies as well. And so as we are really in the business of connecting the private medical community with those resources in addition to managing the ones we have at the state level. So, but we are headed absolutely in the right direction and have seen a substantial increase over the past month, really. But as Congresswoman said, we are now up to 6,000, a little over 6,000 tests per day in the last several days. And our goal really is that 10,000 a day, and to have that capacity across the state.
And one more thing, if I may, at the federal level, as it relates to PPE, I'm co-sponsoring a bill that's called the Ppe Act of 2020 that would institute key reforms to improve our management of the strategic national stockpile and improve the flexibility of the Department of Health and Human Services in their ability to manage the supplies in the stockpile once they're purchased. We've seen some inconsistencies with the supplies as they've been pushed out to states, and there's been some real challenges across the board there. And one additional thing, the CARES Act, which is the bill we voted on at the very end of March, it provided $16 billion to the National Strategic Stockpile to procure additional personal protective equipment, ventilators, and other medical supplies to assist in federal and state response efforts. So there's really pretty strong coordination across Capitol Hill, across the Senate and the House, agreement heavily bipartisan on these issues, and then we're working with our state partners as they are the ones who are in many cases pursuing the actual purchase for what's needed state to state. So I would continue to advocate for a national testing plan, particularly if in the future we are looking towards a potential resurgence of the virus, as many are expecting. I think that now is the time for us to be ensuring that we have the capacity and the capability to manage and contain potential outbreaks into the future once we get this outbreak as relatively controlled as we possibly can.
Thank you, Congresswoman. And is there anything additional you'd like to add as far as closing remarks?
Well, I want to thank everyone who's still with us. We've run a little bit over time. I hope the conversation's been informative. We will have this available on our website for anyone who would like to go back and listen. I want to thank all of our guests who join us on the line. Thank you so much for providing valuable information to the people that I represent. And to the people of the 7th District, thank you so much for joining. I hope you and your families, your loved one, your friends, your neighbors, and colleagues are staying safe. A special note of appreciation to all of our essential workers in our grocery stores and gas stations and hospitals and our mail carriers and delivery drivers and sanitation workers. Thank you for all that you do. For our small business owners and our restaurateurs on the line, thank you for the sacrifices that you all are making in pursuit of public health priorities. If our office can be of help, please call us. We are here to serve you. We are here to answer questions. Please reach out. It's 804-401-4110. Our contact information is available on the website. We have also created resource guides that we routinely update, focused on direct payments, focused on small business needs, focused on unemployment. And please, if we can be of assistance, please be in touch. It is our job to serve you. It is my honor to be your representative, and I thank you so much for joining us this evening.
Thank you, Congresswoman, and thank you everyone for taking the time to join us for this important telephone town hall with Congresswoman Spanberger and our local experts. We appreciate the opportunity to answer your questions. If we weren't able to get to your question this evening, you can call our district office at 804-401-4110 during normal business hours. You can also go to spanberger.house.gov. We will host more of these events in the future to keep you informed on what Congresswoman Spanberger is working on in Central Virginia, available resources in the 7th District, and other important updates. Thank you again. Stay healthy and safe, and have a good evening.